Hello, everyone. My name is Zalla. It is a pleasure to be here as a team of four. In this presentation, we as a group will discuss our understanding and knowledge about viral infection on a population scale. To begin with, let's talk about emerge of some viral infections. Example, swine flu and Ebola virus. There are three papers that we will cover today. The first two papers are directly taken from our class material. These are paper 6, mitigation strategy. The second paper we use is paper 3, strategy of commons. The third paper, which provide a strong connection between the two other paper, is potential mitigation strategy. We are going to talk about viral infection and its examples, such as influenza virus A and Ebola virus. Here is some picture view of these viruses. The first example is swine flu. It is influenza type A. The mutation of farm pigs but was zodiac form. Young people had immunity and the old people had previously exposed to the similar virus. Some of the symptoms were chill, cough, sore throat, body ache, and fever. The estimated number of deaths were 60.80 million. The second example is Ebola. There are two viruses, Zira Ebola virus and Sudan Ebola virus. It was essentially thought that the virus was associated with one person that traveled to different parts of Central Africa. The major cause of Ebola was to reuse the contaminated substance and object, also direct contact to those individuals who die of Ebola virus disease. The symptoms include fever, body ache, headache, muscle pain, and chill. The estimated number of deaths were 11,325. Now let's hear from Tanzeel about our first paper, medication strategy.
Thank you, Zalla, for providing such a great information about some of the pandemics caused due to viral infections. Hello, everyone. My name is Tanzeel. To begin with, we live in a world where, as a biologist, always curious to know what are the common strategies used by viruses to propagate. Let's throw some light on how viral infection propagates. So what happened is the viral genome are packed inside the particles that mediate transmission from host to host. A virus is only considered to be successful if it's able to establish themselves in a host cell body. If we talk at the population level, they spread through the droplets from the carrier, and the interaction with the carrier or droplets of carrier lands on the mouth or nose of a healthy person, touching the mucus droplets on the surface and touching the nose or mouth before the washing the hands. Let's move on to our first paper, which highlights the various strategies for mitigating influenza virus. This paper did a great job in explaining how we can mitigate a viral infection when it becomes pandemic, and especially focusing on influenza virus pandemic. With the utilization of mathematical models such as large-scale epidemic simulation, it throws light on various influenza prevention and confinement processes. So the various strategies include household quarantine, workplace closure, school closure, restriction on travels, social distancing, use of vaccines and face covering. So the various model proposed include looking at the R naught value impact of different strategies. These slides provide various model proposed to see visually what was the impact of strategies of mitigation use. The R naught is the mathematical variable which indicates how transmissible an infection is. For influenza, the R naught during the first wave of 1918 was between 1.7 to 2, which made it a viable candidate for a pandemic. Moreover, the school closures caused a reduction in peak attack rate up to 40%. Establishing border restriction delayed the transmit of pathogens by 2 weeks. Same-day treatment of pathogen with an effective drug would decrease the total case rate by 5%, with an available stockpile educate enough to treat 25% of the population. Now, let's take into consideration some limitation of the model proposed. So, the first limitation is exposure to a new strain of virus that is very uncertain. Exclusion of different socioeconomic background. For example, people with lower status have no access to the vaccination. Since viral infections are airborne, if one person catches the infection, it can spread to another person and ultimately make the whole population suffer. Hence, prevention is better than cure in order to circumvent any pandemic. Transition to why we need to get vaccinated. First and foremost, it primes the immune system to fight the infection. The severity of disease can be minimized. Secondly, if we look at the population level, it reduces person to person transmission. As one of the major findings of this paper, a single dose of an effective vaccine can reduce the susceptibility by whooping 70%. Now, over to Andree to present our second paper, Tragedy of Commons.
Thanks, Tanzeel. You highlighted some really awesome points. Hi, everyone. I'm Andree, and I'm going to be presenting on Tragedy of the Commons. Let's get started with some background terminology. First, what is Tragedy of the Commons? Commons refers to any shared resource. This can be land, bodies of water, and forests, basically any large resource shared communally. Tragedy refers to the resource being depleted from overuse. So how does this benefit us? When a resource is shared, everyone receives equal benefit. The paper gives an example of an equal number of cows per person on a shared land. So what drawbacks does it have? If someone takes more than their share, that individual benefits greatly at the expense of everyone else. Continuing the cow example, the paper describes a farmer adding many extra cows to his personal herd on the communal land, more than what the land can sustain. The cows don't have any food and everyone suffers because of it. So how can we relate this to viruses? The paper discusses how the overuse of antibiotics has led to antibiotic resistance. While this isn't entirely virus related, it presents a perspective I would like to spend some time on. That is the individualist versus the societal perspective. Things like school and workplace closures for safety of as many people as possible, or the economic benefit of leaving everything open but allowing and encouraging virus transmission. While this has a broader focus, let's look at how this can be employed in day-to-day life. Individualists would have a perspective that would include things like visiting the doctor for minor symptoms, which ultimately takes the doctor's time away from more urgent cases, and refusing to limit normal activities while sick. Overall, this takes little to no precaution into stopping the spread of the virus. A societal perspective would include things like visiting the doctor for more moderate to severe symptoms based on the individual's history and refraining from normal activities to encourage healing, but also to prevent spread. Overall, this view takes a precaution into account to prevent viral spreading. Let's go over to Josue for our third paper and tying all of these points together.
Thank you, Andre. Hello, my name is Josue, and I will be discussing our new paper regarding nonlinear coupling of reactive and static mitigation strategies. As you know, global pandemics are created due to dangerous strains of viruses transmitted rapidly through various methods that allow them to propagate in large communities around the world. With novel viruses, the damage caused primarily dominates any form of reactive interventions instead of proactive measures. In this paper, the researchers developed an intricate model relating to a stimulated influenza pandemic in Australia that involved integrating a combination of pre-pandemic vaccinations and targeted antiviral prophylaxis. Some of the components that were incorporated in this model related to Tanzeel's viral propagation methods. Also, the pandemic control measures relate to the types of protocols that were used in this particular model. The possibility of tragedy of the commons assumes an imperative part in how these elevation conventions play out, consequently directing how successful every technique can be. The first mitigation strategy focused on within this paper was pre-pandemic vaccinations. The graph on the right represents the integration of pre-pandemic vaccination programs on a population. The left y-axis demonstrates the number of attack rates and vaccinations, whereas the right y-axis represents the efficacy of each vaccination. Axis signifies the amount of the population vaccinated. As shown in the graph, with increase in the amount of vaccination, the number of illness cases decreases. Also, the efficiency of the vaccination increased rapidly when individuals were vaccinated within the population. It turns out that vaccinated individuals are 50% less likely to get infected compared to unvaccinated individuals. Also, infected individuals who are vaccinated constitute a 30% reduction in transmitting the virus. Most importantly, the pre-pandemic vaccinations alone were not able to provide significant herd immunity for extreme infectious pandemics. They used the R0 value of 2.23 compared to the R0 value of the 2009 H1N1 pandemic strain, which was about 1.5. The second mitigation strategy concentrated on targeted antiviral prophylaxis. Using a targeted approach, antivirals were given to people at risk for severe disease or exhibiting disease symptoms. The two types of targeted antiviral prophylaxis that were investigated were geographic targeting and contact targeting. Geographic targeting relates to the neighborhood distribution of antivirals, whereas contact targeting relates to the usage of antivirals directly to exposed individuals. In this graph, it mainly focused on contact targeting antiviral prophylaxis. The y-axis on the graph represents the incidence of new cases in antiviral courses. The x-axis represents the day of the pandemic. The same R0 value, 2.23, is used again to maintain a consistency with the results. The graph of figure 2a suggests how earlier detection of index cases can slow the growth of the pandemic. The graph of figure 2b signifies how, as the longer the delay rate is increased, the effect on the growth rate of the pandemic diminishes over time. The graph on figure 2c reinforces that the growth rate of the pandemic is delay time dependent. As for the type plots on the right, they depict the understanding of the relationship of efficiency and suppression. The main idea would be as subsequent amounts of antiviral prophylaxis is needed, the efficiency significantly decreases over time. In the case for geographic targeting antiviral prophylaxis, antiviral usage levels may be higher, but efficiency levels dramatically decrease. Now let's transition into combining both strategies of pre-pandemic vaccinations and targeted antiviral prophylaxis. In these time plots, the coupling strategy was shown to have a cumulative effect. The model demonstrates that geographic target antiviral prophylaxis does not work well with pre-pandemic vaccination protocols under the coupling strategy, but the contact targeting antiviral prophylaxis presents a positive coupling strategy with pre-pandemic vaccination protocols. In cases of longer delay times and high coverage, the coupling benefit highly favors the combination between contact targeted antiviral prophylaxis and pre-pandemic vaccinations. The positive coupling region of this particular image plot is mainly due to the integration of vaccinations within populations. Since the disease slowly moves through vaccinated populations, this allows possible opportunities to include late prophylaxis applications to lay down more protection to prevent further spread of the infectious disease. This takes into consideration the constraints of health systems. Health systems are limited in managing the resources and other factors that greatly alter the dynamics of viral pandemic. So, including a couple of strategies mainly under mitigation protocols of contact targeted antiviral prophylaxis and pre pandemic vaccinations can be a contributing element in regulating the pandemics on a population level.
All right, let's tie everything together and look at the big picture of all the papers and how they interlink together. These papers demonstrate strategies to mitigate viral infections within pandemics. We are finding new methods in preventing the amount of viral spread along with being consistent with integrated protocols. Tragedy of the Commons plays a vital role in how mitigation protocols are structured. It's important to acknowledge how the distribution and management of antivirals plays in a pandemic situation. Do we invest in helping groups of individuals who might be more susceptible towards the virus, or do we target those individually where management of antivirals is efficient? Different modeling methods and statistical data assist in comprehending the dynamics of antiviral infections in the context of large population scales. Developing and integrating different dynamic models can help us comprehend patterns or situations involving pandemics on a population level and deciding which protocols can be most beneficial long-term. These topics are important to acknowledge, so future innovations and technologies can learn from previous pandemics. It's important to consider the different types of innovations in the context of mitigating strategies because we can adjust specific steps and conditions in integrated protocols to find ideal methods and ultimately minimize the spread of infectious disease. Learning from past mistakes in mitigating pandemics allows us to understand what constraints might need to be addressed to primarily focus on pre-pandemic schemes. The mitigating strategies of pre-pandemic vaccination and contact antiviral prophylaxis demonstrate suitable options in building new ideas to prevent pandemics from getting too extreme and ultimately saving a lot of lives. Thank you for listening to our presentation. Here are the sources that we used for founding our ideas.